Delegation can be daunting at times and can be very difficult. I'm going to talk about the effectiveness of delegation in nursing. Dele- Delegation is defined as we are nurses that assign tasks to other members of healthcare teams, such as LPNs, CNAs, but we are ultimately responsible for the outcome of that patient. When delegating, the employer, the nurse leader, licensed practical nurse, and delegatee have certain responsibilities. For example, the nurse leader determine what can and cannot be delegated, to whom it can be delegated to. Also develop policies and procedures. They also want to look at evaluating the process. As the nurse, you determine the patient's needs and when to delegate your tasks. You evaluate the outcomes because ultimately, as the nurse, you are responsible for that patient. As the delegatee, you accept responsibilities based on the competency and you maintain accountability. If you want to delegate something to somebody, you want to make sure that they're able to complete that task. Now, when it comes to delegation, there are 5 things that you want to consider when delegating. You want to make sure that it is the right task that is delegated, it's the right circumstance, it's the right person, it's the right supervision, and ultimately the right direction. So, what I mean by when I say the right tasks, these are some of the questions that you might consider. Which tasks are legally appropriate to delegate? Can I delegate these tasks based on our current policies and procedures? When it comes to the right circumstances, does the person have the right equipment or resources to perform this specific task? Does the person have the right supervision to accomplish the task at hand? Is the environment favorable for delegation in this situation? You also want to talk about the right person. Have they received training to perform this specific task? Have they ever performed the task on a patient? Have they ever completed a task without supervision? Are there any problems that may have experienced in performing the task before or in the past? The right supervision, you as the nurse need to provide the right supervision. You need to make sure that you are watching over this patient. Also, the right direction, the last one. You must give them the right direction precisely. You want to specifically tell them what it is that you need them to specifically do. And then you need to go back and evaluate and make sure that that task was completed the way that you had wanted it completed. So I decided to include the state of Virginia, what the state of Virginia says about delegation. First thing we want to talk about is what is needed to know prior to the delegation of the tasks. Well, the nurse shall assess the status and the stability of the patient, determine the type, complexity, and frequency of nursing care needed, and delegate only those tasks that, first of all, do not require nursing judgment. They are not complex observations or critical decisions. They do not require repeated performance of nursing assessments, and they do have predictable results with minimal and not life-threatening. The nurse also needs to assess the training and skills and the performance of the unlicensed person. The nurse will then decide which tasks then are appropriate to delegate. Delegation shall only be made if all this criteria is met. The task or procedure can be properly and safely performed by the unlicensed person. The delegating nurse retains responsibility and accountability. The delegated task and procedure are within the knowledge and responsibility and skills of the nurse. Tasks and procedures are communicated on a specific basis. Now, this is something that's very specific. You need to specifically state what you want them to do. And then lastly, the person to whom the task is delegated, it is clearly identified to the client. So what I mean by that is the client knows exactly the task that was delegated to that specific person for them to complete. In conclusion, please look at delegation and what is required for the state in which you work. Also, look at your hospital's policies and procedures on delegation, for they may differ.